I would now request Rotarian Anand Dalal to introduce Ameera. Anand?
Yeah, one second. Ameera seems to have a lot of friends at our club, but I'm going to do the formal introduction anyways. Ameera is the promoter and managing director of Metropolis Healthcare, a reputed chain of pathology labs with a loyal customer base across India, South Asia, and Africa. Metropolis is rated among the top 1% laboratories globally for its quality systems and protocols. Under the leadership of Ameera, Metropolis listed successfully on the stock exchanges in April 2019 at a 9% premium amidst challenging market conditions. Ms. Ameera led Metropolis into the front lines of the COVID testing in India, apart from advising and engaging with the Indian government to plan a response for the pandemic. Metropolis today has 15 approved and audited COVID labs across the country and performs thousands of COVID tests each day. For the last 20 years, Ameera has focused on delivering sustained growth, built and led corporate functions, including finance, strategy, business process optimization, innovation in investor relations, and many others. Under her leadership, Metropolis raised the bar of diagnostic accuracy, technological equipment, customer experience, and research-driven empathetic services. Ameera has led the corporate transformation of Metropolis by setting protocols, hiring expert professionals for the management team, and bringing together a fully actualized board. Due to its unique growth model and competitive advantage, Metropolis has attracted 3 rounds of investments by reputed private equity investors. Upholding the highest standards of corporate governance and business ethics, Metropolis has built exceptional value for all its stakeholders. Ameera has received a degree in finance from the University of Texas at Austin and is an alumnus of the Harvard Business School's OPM program. In addition to being a propagator of organizational empathy and gender sensitivity, Ameera is also an active financial investor and a business mentor. Passionate about the women leadership and empowerment, she has committed to supporting budding women entrepreneurs. This led her to set up Empoweress in 2019, a non-for-profit platform for women-led businesses to find advice, mentorship, and microfunding. She's an eminent industry spokesman and has featured as a speaker in various national and international forums, industry events, and conclaves organized by IIM, Harvard Business School, TEDx, CII, FICCI, Twitter, and others. She has also been elected the secretary of the IAPL, which is the Indian Association of Pathology Laboratories, and has served as the chairperson of the FICCI Health Services Western Subgroup. This drives policy decisions at the center. She is an independent director on the board of several Indian reputed companies, including Marico Kaya, Torrent Pharma, and Shoppers Stop. She is also an advisor to Baylor College of Medicine, Texas. She is also the global advisory board on the global advisory board of AXA, a Paris headquartered company with 700 billion under asset management. With such an illustrious career, no wonder she is a recipient of several awards. I'm just going to read out a few that she's received. She's been the Woman of the Year award by the ladies wing of the IMC Chamber of Commerce and Industry in 2021. She's won the Mumbai Ratna Award in July 2021, the EY Entrepreneur of the Year Award 2020 under the Lifestyles and Healthcare category. She's been rated in the Forbes Asia as the Power Businesswoman of 2022. She's been the most powerful businesswoman in Business by Business Today in 2018 and 19. Powerful Businesswoman in Business by Fortune India successively for 4 years from 17 to 20. Forbes Asia listed her as the woman to watch in 2015. She's been the young global leader by the World Economic Forum in 2015. She's amongst the 40 under 40 years by Economic Times and Spencer Stuart of 2014. Bloomberg rated her as an exemplary woman leader award at the World Women Leadership in Congress Award in 2014. And she's also been the Young Entrepreneur of the Year Award in 2011, organized by Entrepreneur India and Bloomberg. We're delighted and honored to have Ameera amongst us. Over to you, Ameera.
Thank you, Anand. That was very embarrassing introduction. Way too long. But it's such a pleasure to be here. I see so many friendly faces, some role models, some people I've grown up with. Friends of my parents, and I got a call last night as well from somebody who's part of your group and who's been a colleague of my parents. So it's really lovely to be here. Thank you so much for having me. I've been asked to sort of talk about the journey along the way, and I was thinking about what is it that I can share that can be of any meaning and people can take back in their own lives, if anything, and find it useful. So I'll just start by sort of, a lot of people focus on the outcome of the journey, and a lot of the things read out today were the outcome of the journey from a professional sense. But I think what's more interesting usually is what's the input that takes to actually bring that outcome. And I'll share a little bit about my childhood because that was a big factor in whatever has happened for me. And then, of course, the journey of actually building Metropolis. But it's been a roller coaster journey. It's not been an easy journey at all overall. And I'm very happy that it's been a roller coaster journey because, frankly, the best learnings and life lessons come when you had ups and downs and not when it's a straight path. So growing up, some of you might know my parents, Dr. Sushil Shah, who's a pathologist, and the founder of Metropolis, Dr. Dhruv Shah, who's a gynecologist and obstetrician. And growing up, they were very, very unique parents because unlike most parents in India, usually who are very protective about their children and wanting to bring them up in sort of perfect circumstances, my parents were very contrarian. And from a very, very young age, they actually gave us a lot of independence. So I traveled to the US alone when I was 15. I went on, lots of camps for a month away, months away when I was much younger. They really encouraged us to take risks. They really encouraged us to be independent, to make our own decisions. I mean, I chose, I decided what SATs I was going to study. I chose the professors. I entered, I did the colleges. I applied for the applications. I went to the US. I earned my own scholarship. I mean, it was all a journey where there was a great amount of support from my parents at the back end, but they almost never came to the front end where they actually made decisions for us. And I think the reason I bring this up is because if I think back today, the last 20 years of me building my career, a lot of those skill sets that I actually learned from the age of 5 to 20 from them, of managing our own money, of doing all of those things on our own, helped me a lot in building my business. Traditionally, especially for women in India, parents bring up their daughters very protected, wanting them to feel like princesses. Unfortunately, princesses are taken care of, but princesses don't always take care of themselves. And one thing we were always told is don't be a princess, take care of yourself. And they gave us the tools along the way on how to do that. The values that I learned at home were always about excellence and never about money. I mean, we almost never talked about money at home. We used public transport, we walked to school, even though there was a car and driver. We hardly went on international holidays. And the whole conversation at home was always about how you can make an impact, how you can make a positive social impact on society, how you can be excellent at what you do. And there was never a conversation about buying this car or buying these things or, money or how much money they make. And the reason, again, I mention this is because I feel that when we are learning to be passionate about being excellent and being damn good at what we do, the money flows automatically. But the minute the focus is on money, often the route to getting that sometimes becomes compromised. Often you see people whose focus is not to do their job well, but it's how do you make money at the fastest pace. And that was not what we learned at home. So I was here till I was about 17, 18, and then I went to the US. I chose a public university because I could meet a lot of different people of different backgrounds. And I came back to India actually because I was very patriotic and I felt like if all of us, who are in this crowd, who have been well educated, who've had the best of what India can offer, and had education overseas, if we all sort of leave the country, then, how do we give back to our people, right? And that's the reason I came back in 2001. And that was the journey to actually then building Metropolis. I was almost 21 at the time. And I saw that both my parents had built phenomenal, doctor-led practices for themselves. My mother as a gynecologist was one of the most well-reputed. My father was very well-reputed in South Bombay. And the question was really, how can and is there an opportunity to make something of healthcare, which is an institution, which is beyond the individual? Because as we know, the medical practice in India, whether pathologist, gynecologist, hospital, we all make our decisions based on the doctor and not necessarily always the brand. And the challenge and the opportunity was, how do we make this brand, which starts from the same values of the individual, but then gets scaled and built across the whole country and hopefully beyond overseas as well. And what I found that my father had actually built a very good quality practice. People respected him. They respected the quality. They respected the services. He was doing something different. He wasn't just following what every other pathologist was doing. So there were a lot of unique traits to it. And I felt like this was an opportunity to really make something much, much larger. And that's how the journey really started in 2001. It's been 20 years now. It feels very strange saying that, considering I'm only 42 years old, but that's the reality. And in the last 20 years, we've gone from one lab to about 130 labs where we are. We had one center. We are currently at about 2,700 centers. We were a 7 crore enterprise at that time. Currently, we're valued at about 2 billion on the stock market. We had 40 employees. We have 4,500 employees. We were in one city. Now we are in 200 cities in India and 5 countries. So it's been a journey which has been phenomenal, but not one without its pricks and its challenges along the way. And I always say, even though I'm the face of the business, and often I'll end up getting all the credit, nothing is ever built by one person alone. It's always, at the end of the day, the team. And we've been very lucky to have some very, very passionate and emotional people attached to the brand, because you require that emotion to stick through something and to be resilient over 20 years. It doesn't happen only through rationality. And I think we've been lucky to have that. But if I sort of focus on, what have been sort of my 5 key learnings during this journey, because, the journey is very long and I don't want to go on about it. But the 5 key learnings have been that, one, in healthcare especially, it's a science, it's healthcare first and a business second. And that was a very core value that I learned from my parents very young, that the patient comes first. Your financials, your cost cutting, your marketing, your communication, all of that is secondary and third. But what comes first is the patient. And the patient is usually coming to you in a time when they're anxious. Something is wrong in their body or something is wrong in their mother's body. And that time, the whole family is anxious. So how do we engage with the patient where they feel they can trust us, they feel reassured, they feel we are there as partners to help? How can we lower that anxiety? How can our processes really make them feel like trust is not gone out of the window? And I think that has really been the attempt for us to focus in the last 20 years, that the science is solid, the care is solid, and everything else comes sort of secondary. And there has been a lot of temptation, because in every business and in every industry, there are always players who do shortcuts. There are players who will give extra discount. There'll be players who market like crazy, but don't actually deliver anything of substance. There will be players who go and do corruption and try to get deals in that way. So there will be all kinds of players, especially in a market like India, which doesn't necessarily have minimum standards for most things, or doesn't have regulatory frameworks for most things. Like in healthcare, there's no regulatory framework. Anybody and everybody can start a path lab, which means you have all kinds of fly-by-night operators that come into your industry. And often along the journey, you're trying to do the right thing. You're trying to do everything correctly. You're trying to be, good governance. You're paying your taxes. You're paying your employees, while other labs are not paying minimum wages. They're not paying taxes. They're not even doing tests properly. They're, taking the urine and throwing it down the sink and calling it a urine test. So you see this happening. And the temptation is to say, look, am I doing something wrong? Can I do something differently? And I think to hold on to the core values and the purpose of the organization, to me, has been the one of the most important learnings, that never to get sidetracked with what other people are doing, however tempting it may look in the short term. I would say the second very important life lesson that I've learned around the process is to be fair and to be transparent. So whether it's to our employees, whether it's to our investors, whether it's to our customers, our stakeholders, at every stage, building your reputation, which is going to be your biggest asset at the end of every factor, is going to be the most important thing that we do. So whether it was investors who often we felt, and I've heard this from Indian promoters a lot, right, that, oh, the investors just riding off my coattails and they don't really deserve to make so much money. So why should I let them make so much money, and I'll cut them out and buy them off cheap, and I'll make more of the money. But when you do that and an agreement is breached, even the spirit of the agreement is breached, often I see that word spreads. And those same investors or the different investors will come back and ask your original investors, look, how were you treated? And that will come back and be a problem for you in the future. So I've seen that just being fair, being transparent, and is very, very critical in the building of the brand as the biggest asset, and the building of your own reputation as part of that. I mean, the first time I raised private equity, we had 4 investors. That was 2006. We had 4 investors who were interested and who came and gave us term sheets. The next time in 2010, ICICI Ventures was our first investor. They exited to Warburg Pincus. I had almost 10 investors who were interested. And then I came to 2015, where I was looking to buy out a hostile partner's stake, get them out of the business because they were creating a lot of damage in the business. And I decided to buy Warburg Pincus's stake. And it was very easy for me as a promoter to go and haggle with them and negotiate and get them out cheap. But we chose to do the right thing and pay them fair market value as what was determined by third parties. And I did that by actually taking debt from KKR and then buying out Warburg. Now that debt was, by the way, at 20% a year, right? Excruciating debt and interest rate. But the reason we did that was, one, because we believed in the business. And second, we were very clear that we did not want to cheat anybody out of what was their deserved value. And the reason I say this is because, when we've done this, at every single moment, throngs of investors have been happy to come and back us because they've heard about our fairness in the market. So whether it's with employees, customers, or stakeholders, I'm a big proponent of integrity being a very, very critical part of the way you build the business. I think third lesson, which actually my father taught me when I was very young. I remember him telling me, from the time I was 7 or 8 years old, and he would ask me, what do you want to be and what do you want to do? And I, of course, had a new story every year, right? Once I was an interior designer, once a fashion designer, once an astronaut, once an architect, lawyer, etc., etc. And I remember he always told me, he said, I don't care what you do. You do what you want. You want to be a hairdresser, you be a hairdresser. You want to clean garbage, you clean garbage. But you better be the best at what you do and be different. And that be different was something which was told to us from a very, very young age. And that was not only be different in terms of profession, but it was be different in terms of your thought, be different in terms of your behavior, be comfortable to be different, especially in India where, we are all usually conditioned to follow a similar thought process. We are always afraid of what society will say about us or our families if our children, or if we do something a little bit weird, as people call it, or a little bit strange, or a little bit out of the ordinary. We often tend to be quite concerned around not being different, right? You want to be the same because we want to fit into society, because that's such a big part. But often it's the ones who think differently are the ones who actually land up finding a different path and finding a different journey. And the comfort to be different and not feel the pressure to be the same like everybody else was actually something my father gave us as young children very, very early. We were always told that, you don't have to worry about what people say about you. You don't have to worry about any of that. But, you do what you believe is right. And as long as you're comfortable with it, we'll back you fully. In our journey in Metropolis, we've always been pioneers. We've done things differently, whether it's been about saying we want to be the first at starting new tests, whether it's been saying that we're gonna approach this differently, or whether it's been saying that in our industry there tends to be corruption like in India, like there is in every industry. And we're not going to be a party to that. We're going to do things our own way, the straight way, the real way, the honest way. And that's really paid off for us, is the comfort to be different. Fourth, I would say, lesson that I've sort of seen along the way is we have to not only have a right to win, but we have to deserve to win. I've often seen businesses, as I said earlier, where there's crazy amounts of money spent in marketing. And today's time, with a lot of the startups, is the best example of this, right? The amount of money that's spent in acquiring a consumer is amazing. It's crazy. But the amount of energy that's put to retain the customer and to keep your consumer happy and engaged and is not always as much. And so I think the focus has always been that we have to deserve to win. Whether we enter a new market like we entered Africa, whether it's a new service line, whether it's a way of doing things, we have to be so good that we not only have a right to win, but we deserve to win. And building the substance over the style has been a very critical, fundamental part of how we've built Metropolis. I'll give you a simple example. So many times people would come and tell us, oh, somebody would come and say that, oh, why don't you make your centers really flashy? Why don't you make them really large and really beautiful looking like a 5-star hotel? People like that, they want to feel that. And we always said that, look, if we have a certain amount of money to spend on the profit and loss statement, it's a choice whether to spend that money then on amazingly beautiful 5-star looking centers, or do we spend that money in our back end to make sure our quality is right every single time and still have reasonably good looking centers? But should we spend it in quality of talent? Should we spend it in processes? Should we spend it on quality? Should we spend it on the way we draw blood, the service? And the answer we every time came to, the substance has to be more than the style. Because in healthcare, what matters every single time when you're not well is that assurance and trust and credibility of the report, not whether you were given, a cup of orange juice with an umbrella sitting in it when you came to the center. And I think that has been, a big focus of ours the entire time, and that has really aided us in building a very credible, consistent brand throughout. And the last one, which is maybe less about the business, but more about the individual and the leader. I often say that, when you're a startup, as a leader, your startup is a complete mirror image of you. If you are anxious as a person, your startup and your culture of your startup will be anxious. If you are impatient and angry and irritable, your culture of your startup will be the same, because you are the startup when you're, few people. When you become a more mid-sized organization, you've allowed other people to influence the culture of your organization, right? And as a mid-sized organization, we have to do that. When you get large, the leader's job changes. The leader's job becomes more about, how do I stay the soul of the organization? Because there are so many influences now. How do I keep to the values? How do I keep to the purpose of the organization, and that we don't get diluted? And I think one of the most important things the leader has to do as the entrepreneur or the leader or the promoter is to really maintain self-balance, because our emotions land up becoming otherwise superimposed on the organization's emotions. So one of the things I've tried to do is use every step in my journey. And there have been many different experiences, whether it is about joining groups like yours as Rotary, where you get perspective and you have friends and you build relationships, YPO, where you get inputs and you have forums and you get other people telling you how, what you can think about differently, or their own experiences, whether it's been about hobbies or work or parenting. Each of these are times in our lives which we come to know a little bit more about ourselves, and how we can use that information to balance ourselves better, balance our emotions better. Because as we balance our emotions, as we know, not only does it have a better impact on our kids, but it has a better impact on our business. We'll end up making better quality decisions when we ourselves are more balanced. And that's been sort of the other learning in terms of how much energy and effort to put in balancing myself, so I can therefore make better decisions for my organization. These have been some of the learnings, and obviously the journey has been very long, and I can talk a lot more about it. But one of the key messages that I'm always left away with is that any sort of power that all of us have in our families, in our businesses, really is not so much about being powerful, but it's really more about being powerful is to empower others, and how we can use that power that we've received as heads of families, as heads of businesses, to empower others in their journey, I think has been, for me, one of the biggest, most fulfilling understandings. And therefore, as I've gone to implement that by mentoring others, by helping other entrepreneurs in their journey, it's frankly been an extremely fulfilling part for me. And I know clubs like Rotary and others are actually part of that, is how you give back, right? And how you impact the lives of others. And I think there are various ways to do it. For me, my platform of Empoweris, which has been about helping other entrepreneurs, especially women entrepreneurs, because it's a very lonely journey, right? There are not that many women entrepreneurs in the country. Unfortunately, there are very few role models, and the journey for a woman entrepreneur is very different than it is for a male entrepreneur, because gender bias does come in, gender challenges do come in, and some of them are external, but a lot of them are internal. So how can we provide that support, that help, that hand-holding, that skill, that peer-to-peer learning for women to really go ahead and dream big, and then to go about and actually achieve their dreams. And it's been a great journey for me in doing that. I'll just share a little bit with you about sort of this last 1.5 year, and then I'll stop and we can open up Q&A. But the last 1.5 year has been, again, very interesting because, in March last year, I gave birth literally 10 days before lockdown to my first child. And then we went into lockdown, and I was hoping and estimating that I would have had 45 days of a break where I could just focus on my child. But that was not to be. And COVID hit, and we literally got into 8 hours, 10 hours of policy making with the government every day, from the house. And then since then, we've been in action to really build COVID labs, build operations, scale it up, provide that kind of support to all people who've needed COVID. And of course, we had to continue running the rest of the business as well. But what's been a really interesting learning for me in the past 18 months, that when March happened and everybody's revenues tanked and everybody's profits tanked because nobody was obviously coming out and utilizing services, healthcare also got badly hit, right? We had a drop of 70-80% in revenue the first month. And the temptation again there is always to make shortcut, to do short-term actions. To say, okay, slash, cut and burn, because how do you survive? Do you have enough cash on books? How do you pay salaries? How do you provide services? And one of the learnings that we had is, and fortunately we had cash on books, so we were comfortable. But one of the learnings we had was that our employees at this stage are actually more important than our customers, because our employees were risking their personal safety, their personal lives every day, leaving their own families, coming to work, going to people's houses, by the way, getting beaten by police on the ground because police were not willing to accept that they were healthcare people who were going to take care of people in their houses. And we had to make sure that our employees were fully taken care of, mentally, physically, in every way. They felt so reassured that the organization was right behind them. Because you can imagine the situation. On one hand, we had calls pouring in. Our call center used to be used to getting 3,000-4,000 calls per day. And overnight, it jumped to 12,000 calls per day. So how do you deal with that, right? You can't do anything overnight. Overnight, you're bound to be in a situation where customers are unhappy. Now, when the customer's unhappiness comes, it comes all on the team. So on one hand, they are petrified of their own safety. They've not been vaccinated. They are scared every time they go to a patient's house whether they're going to get corona. On the other hand, you have all these patients putting so much pressure on them because you have unhappy customers. You have management putting pressure on them. So these guys were just getting sandwiched and completely burnt out. So we decided that our focus is going to be their health, their safety, their mental balance, their physical comfort. And we did everything possible as an organization to support them. And we did not look at all at what the costs were, right? We just threw a lot of money and a lot of communication at the problem. And what the benefit out of it has been, we have seen the lowest attrition that we've ever seen in the last year in the company because people felt backed up. We've seen the way we treat our employees is the same way they treat our customers, especially in a services business, where empathy is such a critical part, of what you're trying to communicate. And we landed up having a team that's being more passionate, more emotional than they ever were before. So I think our decision of saying we're not going to cut salaries, we are not going to do any of those short-term actions, and we're only going to focus on the long term and focus on employees really led up, helping us not only survive this COVID crisis, but truly thrive in this COVID crisis. And hopefully along the way, we've been able to take care of millions and millions of people in India as well. But that's been a little bit of the journey. I'm just going to stop there and thank everyone for your patient audience and happy to answer any questions that you may have.
Thank you, Ameera. That was such a meaningful, mature talk. And I can see that, you being empowered by your father has probably given you the kind of strength to go through and grow as you did. I have a question. Could you explain how you have been able to transfer the culture that you're talking of over so many of your centers? Do you have a process, or how do you ensure that culture, stays?
Yeah, look, I mean, culture building is for sure the hardest part of the journey, right? Because you can put technology, you can put processes, you can put systems, you can do all of that. But finally, the way people feel, and I think the culture comes from some tactical things and some strategic things, right? So, for example, the tactical things we can do is a lot of communication, a lot of training, a lot of communicating our passion. Often I tell all my guys, whenever I talk to them, I say, look, we are receiving hundreds of thousands of samples per day, right? It's very easy to look at this as a factory. It's very easy to look at, say, how can we automate? How can we do this? How can we do that? But for the person who's giving their sample, it's their only sample. It's their mother's sample. It's their brother's sample. It's their own sample. And for them, that sample means everything. It's days of stress. It's days of anxiety. How can each one of us treat every sample like our own mother's sample? And if we can do that, that differentiates us from anybody and everybody else, because that level of empathy and passion is very difficult to translate across thousands of your employees. A lot of it comes from us being obsessed with consumer and patient experience. I mean, till date, if there is an email I get, which I have a customer who's upset, we dig down to the detail, right? We go to the root, and it's not just my team, it's me. We all go down to the root of saying, how did this happen? Why did it happen? How can we comfort the customer? How can we give them what they need? And how do we solve this problem? So I think a lot of it is about the leadership action. Of course, some of it is about the communication, the training, the processes, the systems, the kind of quality of team that you add, the recruitment itself, and technology. It's a combination of all of these, and it's never a one-time project. It's an ongoing project every day. Because in India, the attrition levels, especially at lower levels, are so high in every industry. It's 20-30%. I mean, hospitals have 53% attrition for nurses, right? So, every day all you're doing is training and training and training, and you just have to keep doing it as a constant project.
So it looks like you're a very hands-on leader.
Yeah.
I think we have a few questions. Ameera, I hope you'll be willing to answer. Satyan?
Yeah, thank you, Shoni. Ameera, that was really inspiring. In fact, I commend you on the success that you have achieved. Now, you mentioned that COVID impacted you, and related to that, I wanted to ask you that have you thought of something on the home diagnostics front, and whether that's a way to go forward, because that is something which has taken off in the in USA right now.
No, it's a good point, Satyan, and home diagnostics has existed for donkey's years. It's not something new. So even if you see like a glucometer that most diabetics use is home diagnostics, right? But even if you take the glucometer, if you compare it to what kind of results you get in a lab like ours, it's only 70 to 80% as accurate. Because number one, home diagnostics takes blood from the capillary, which is from your finger prick. Which is not stable blood, because as it mixes with the air, it gives you variable results. So even though you have home diagnostics for CBC, for LFT, KFT, many other tests, you'll actually see if you do them at home, you'll get very variable results, right? So they are not necessarily consistent. Science has still not got to the place where home diagnostics is as reliable as what you see in a lab like ours, which is sort of globally acknowledged. So I think it will come, but science needs to still move a little bit further for that.
Thank you.
Jaggi, you have a question?
Yeah, Ameera, wonderful talk.
Thank you.
I'm sure you know and been probably following this case of this Elizabeth Holmes in the US, Theranos, which has a lot of relevance. The opposite end of what all the humane stuff that you talked about, and especially since it touches private equity and greed and your industry. And maybe you could tell our colleagues who aren't fully abreast a bit about this, but what lessons, and there's so much common ground in a way, using private equity and valuations and stuff like that, because I know the US is, as you know, is spellbound with this whole case at one level.
Yeah. No, look, I mean, I think Elizabeth Holmes and Theranos, which is the case that he's referring to, is a story basically about a very young a woman who was a scientist and a researcher and found technology that she claimed that could do tests very quickly and do multiple tests from one finger prick of blood And it went on to very, very quickly become this huge phenomena where the company was valued at 9 billion, even though they had no revenue. They had all these very, very, powerful men on the board, and et cetera, et cetera. It went on with a huge story. She was on the cover of every magazine, et cetera. And I remember as this was happening, so many well-wishers and friends would just send me links. This was when it was live. They used to send me links of articles and say, why are you people not doing this? Why are you guys not doing this, right? And I used to always tell them, I said, look, it's very new. Let's wait and watch what happens, because healthcare is one of those industries. Like I said, you have to focus on substance over style. I know from the inside, and by the way, there's also a book called Bad Blood on her entire journey. And you'll see, for example, very basic things that we do in pathology as global practices. Let me give you an example. The way we collect your blood, right? The angle at which we collect your blood matters, because if we land up getting a clot in the vacutainer, that result will be 100% wrong, right? The number of times you shake the tube matters, because the clot either gets dissolved or not. The container in which we collect your blood has got chemicals at the bottom. Now, I would say large number of labs, if not 99, but large number of labs will take shortcuts to say, look, why do I need this chemical? I can just collect it in a plain tube. Right? But if you don't have the chemicals, you don't get the right results. So in our country today, there is no regulation at all for what you have to do, and no government is watching, nobody's watching. So when you go to a path lab, it is 100% dependent on them and their own moral conduct and code about whether they take care of everything along the way in terms of quality, or whether they take shortcuts. And that's where we chose to be very clear and different, and said that we will never take shortcuts. However tempting it may be, how much of a money it may save us, we're going to be very clear. Our practices and standards will be global and world-class, and we will have American agencies come and audit us every year and check us every month, because we want to stand for that. What Holmes did not do was that they did not have a clear value system around how they would operate in healthcare. See, private equity and valuation and business is not a bad word. These are all good things. They can help you get to your goal faster. But you have to be clear what your mission is, what your purpose is, what your boundaries are, what you're willing to do, what you're not willing to do. And often I've seen businesses who are in a hurry. This journey I've explained to you is not only 20 years of my journey, it was 30 years before that of my father's journey, right? But businesses which want to try and build the same thing in 5 years are going to have to compromise on something. Now, either they throw money at the problem, right? But still in 5 years, even if you throw money at the problem, you don't have the quality of experience that you need to deliver the right healthcare. So to me, this is a case of a lack of a moral code, a lack of boundaries, and getting very caught up in the momentum of the outcome of the business rather than the input of what needs to be to build a good business.
Thank you. Thank you very much.
Ameera, one last question. Since you are so involved in the, the COVID testing, whether you've seen some kind of pattern after the vaccinations, whether you are able to say we're coming closer to the end, anything, any advice, anything that you've seen in all this couple of years of testing that you've done?
Look, if I just go back to March last year, when the lockdown started and we started to have the first COVID infections, we actually got out of Bombay and we went to our farmhouse. And the reason for that was because it was very clear to me and to my husband that this was not a short-term situation. This was going to be a long-term situation, because viruses like this are fundamentally, they mutate. And their whole job as a virus is survival of the fittest. So even if you go back to last November or December, the virus that was the most predominant at that point of time, which was the N44K, got wiped out by the B1617, because it is about the survival of the fittest. So when a new virus comes up, it kills all the other viruses, or it diminishes their potency, and it becomes sort of the alpha of the viruses. Now, the vaccinations that have come in can only protect us against the mutations that we already know of, right? So it can protect us against what mutation we knew of last year, because that's when the research was this. Now, if the virus mutates, which it will, like the Delta virus was a mutation, the vaccine doesn't protect us against that. which is why you've seen in the US, even though a large number of population was vaccinated in the US, you still saw the infection spreading with the Delta variant. Now, what the vaccination does do is it protects us from mortality or from severe illness. So vaccination in my mind is a no-brainer, right? And we'll have boosters and more boosters, and that will keep going on. And we'll have to keep updating our antibody and our vaccine status. But at the same time, the virus will keep mutating as well. So there is no guarantee that we are not going to have a third wave. And there is no such assurance that now we are in the clear. Honestly, it depends on the pace of vaccination, and it depends on the pace of the virus mutation. And I think in India, we are at a slight disadvantage because we are such a big country that our pace of mutation will never outpace the pace of mutation. But we have to not look at this as an India situation. We have to look at it as a city-wise location. So if I look at Bombay, for example, if I look at Bangalore today, 75% of people have had the single dose. Almost 50% of Bangaloreans have had the double dose. So they are far more protected because even if the virus mutates, as a group of people, they are standing saying, you're not going to enter us. It's like a barricade. In Bombay, our 2-dose mutation is still very low, much below the 50% number. So I think we are still at risk, if you ask me. And I'm seeing the data, and honestly, I get to know in 5 days' time whether we are, in a third wave or not. I mean, I remember in February, we had the big problem in Bombay in March 15th, this year, where the second wave came. And on Feb 3rd, I told my husband, I said, we are in for a second wave. Because we get to see the data. If I see 5 days at a stretch, right, where each city, and I'm picking up samples from 200 locations, I can come to know in 5 days whether we are headed for a third wave, right, just from the analytics. At this point today, the numbers are moving a little bit up and down. There is an increase. Bombay is seeing an increase. And it is a possibility that we may be at the very, very early stages of entering a third wave. But it's not 100% sure yet because I haven't seen that over a period of a week consistently yet. But I would highly recommend to continue to be very safe, take your vaccinations, and just keep the resilience that this is not all over yet.
Thank you. We need to hear that. Akshay, would you please go ahead with the vote of thanks?
Hi, Ameera. Thank you so much for spending the afternoon with us. Firstly, I would like to thank Rotary for giving me a chance in all the 13 years that I've known you to finally get in the last word. And jokes apart, Ameera, you spoke about patient first, you spoke about empathy. These are good words, but I know that at Metropolis, being a friend of yours and also being a consumer and a customer, I've seen these words being implemented down to the last mile. So many, many congratulations to you on that. Thank you once again for spending the afternoon with us. And as a token of our appreciation, we will plant 10 fruit-bearing trees at Nilmati Dandwal, Gram Panchayat, Maharashtra. The said certificate will be forwarded to you shortly.